former special assistant to President Trump for health policy and an infectious disease epidemiologist. She joins us now live from Washington. Katy, thanks for coming back. You know, it sounds good to have a vaccine before the end of the year, but given the timeline it takes to research and test one, is this timeline too optimistic?
Well, I will say that if you don't set an ambitious goal and a deadline, you definitely won't reach. So that's just the basics of project management, right? President wants a goal that is as fast as it can be done, then you have to set an ambitious target. I know that the president's critics are quick to criticize him when he doesn't move quickly enough. And yet they're also quick to criticize him for trying to move overly quickly. So I think that, I'm feel more reassured that he's set an ambitious goal.
And Katy, how much of these lockdown measures and social distancing guidelines, though, can really be eased before there is a vaccine?
Well, I think they can all be eased before there's a vaccine. I mean, there are a number of diseases, infectious diseases, that we don't have vaccines for, but we have other interventions. I think of HIV or malaria. These are difficult diseases that, have been extremely troubling in human history, but there are successful interventions that can control the spread of them. And the same is true here. New York and New Jersey are already starting to come down from their peaks, and they have implemented non-vaccine interventions. So I feel confident that the American people are starting to use the data that's being given them by their governments, local, state, and federal governments, to do their own risk assessments. And I hope that governments will continue, the local and state governments will continue to allow citizens to make those judgments for themselves. We make complex risk assessments in our lives every day relating to planes we get on, speeds we drive, people we hire to care for our children. We make a number of complex risk assessments, and I think the American people are capable of doing that.
Katy, even when you do get a vaccine, there are fears that a lot of people won't take it. There's a whole campaign of misinformation out there led by anti-vaxxers, and we know that social media is such a powerful tool. How do you combat that?
Yeah, you can only combat fear with truth. And I think fear is often fueled by a sense of mistrust in government. And that's why it's really important that the Trump administration has been as transparent as they possibly can. That's essential to continue. And I hope that all the state and local governments are as transparent as possible as well. We're doing our very best to inform our citizens with everything we know and what we don't know, and being honest about that. And as the vaccine candidates are put into clinical trials, it will be essential to be honest with the participants in those trials and also about the results of those trials to ensure that people can make judgments for themselves and their families.
All right, Katy Talento, we really appreciate your expertise. Thanks for coming on.